Hello, my name is Angelo Tsirbas. I'm an oculoplastic surgeon and I specialise in surgery around the eyes. Commonly this is known as blepharoplasty, so it's basically taking away and resculpting and repositioning tissue around the eyes. Often patients will come to me and say, my eyes look tired, I've got bags under my eyes, I look older than I feel is a common complaint. One of the things when I was working in Beverly Hills was that people were subspecialised or super specialised, as I like to call it. I used to do all facial surgery and I'm a member of the Society of Facial Plastic Surgeons, but I've limited my practice now just to eyelid surgery and the tissues around the eye. It's important to have a background in facial plastic surgery because, as you know, the face ages as a unit. So many of the patients that we see do have other parts of their face that are old. They may need a neck lift, they may need some facial work, they may need a rhinoplasty. So I have the ability to speak with them about that and work with other surgeons that are specialists in those areas to give the best result. It's also interesting to note, however, that often one of the first parts of the face that ages, especially in younger women, once you get into your 40s, especially in Southern California where I was, and also in Australia of course, is that the eyes tend to be a little bit ahead of the curve. So many patients notice that the eyelid skin starts to sag a little bit. They may notice that the eyes look tired, that they have bags under their eyes or dark circles. All these problems tend to predate aging in the rest of the face. So often patients will present to me and as the first port of call and say, look, I think I look tired and I think I need eyelid surgery. Part of the benefits of being a specialist in this area are that you don't just do one operation for everyone. It's important to realise that if you specialise in just one area like I do, you have a range of operations, an armamentarium of treatments that completely individualises each surgery, each treatment, and sometimes surgery is not the answer for patients. So you need to have the experience and the ability to say, you don't need surgery. You may be better served by having some Botox, or you may be better served by having some volume fillers of whatever type you like. But when you do need surgery, it's important to realise that it's not about taking tissue away. It's about repositioning the tissue. It's about moving prolapsed fat or areas where there is no volume and filling them up. It's about giving the eye its youthful contours and rejuvenating that area. It's not about taking all the fat away or taking all the skin away. If you notice, if you look at an older person's eye, perhaps someone in their 70s, you'll notice that there's no fat in the eye socket, that there's no skin. So taking tissue away gives people an older look. It may look good for 2 or 3 years when you put your eyeshadow on and mascara, but if I were to see that patient in 15 years' time, which I often do, the result is not long-lived. And the patients are often much worse off 15 years later than if they'd never had any treatment at all. That's part of the reason that I thought I would limit my practice just to eyelid surgery and blepharoplasty. And I think bringing this expertise from the US to here and just concentrating on that area will allow me to give better, more natural looking and far long lasting results.